Hi, my name is Sue Dyson. I'm presenting on research done by myself, Emma Sherry and Emma Seal in 2018. I'm from a public health background. Emma and Emma are from sports management. In this presentation, I'll be outlining what we mean when we talk about primary prevention. I'll be reporting on the research we conducted for the Victorian Government Office for Prevention and Women's Equality, and I'll present the principles and guidelines we synthesised from the research and the subsequent roundtable discussions that were held. In Australia, nearly 1 in 3 women over the age of 15 reports being subjected to gender-based violence at some time in her life, and 1 in 5 has experienced sexual violence. In the state of Victoria, we have VicHealth, a statutory authority funded by government taxes on cigarettes. This health promotion foundation is one of only 3 in the world. Over the years, VicHealth has funded programs, research and evaluation into prevention of violence against women. This was further bolstered in 2015 and 16 with the implementation of a Royal Commission into Family Violence established by the Victorian Government. The Government has promised to implement every one of the Commission's 227 recommendations. Why sport, you might be asking? In Australia, as in other places, sport has a strong role in communities and represents a place where people come together as families. Hence, it's one of the settings that has been the focus for prevention work, along with education, workplaces, faith-based communities and others. Our project focused on sport because of the ways it can influence attitudes, behaviours and social norms. Primary prevention is about preventing violence and abuse from happening in the first place by addressing the drivers of violence against women. Research tells us that there's a strong association between violence against women and gender inequality. However, it's more complicated than that. We don't really understand why some men think it is okay to be abusive or violent, but we do know that some of the factors that are strongly associated with the phenomenon and some of the ways that prevention programs can address this. Prevention focuses on addressing the drivers by challenging sexism and violence supporting attitudes, by promoting women's independence and equal participation in decision making, by challenging rigid gender stereotypes and roles, and by promoting positive, equal and respectful relationships between women and men, girls and boys of all ages. From research and practice, we know that there are a number of factors for success in prevention. These include an authorising environment, by which I mean the governing bodies to which organisations are accountable. For sport, this might include state and national sporting bodies. It might also include national and state government. In Victoria, the Royal Commission gave us a strong authorising environment that was backed by government commitment to implementation. It's also important to understand the interplay between gender and power. In brief, we work from an understanding that gender and gendered patterns of behaviour are socially constructed and therefore transformable, as opposed to being fixed, immutable biological givens. We believe that change is possible, albeit probably slow and incremental. We know that focusing on negatives does not encourage participation, so we use a strengths-based approach that builds on community skills, knowledge and potential. This helps to engage as many people as possible. Experience tells us that prevention programs work best when they have leaders who are well trained and flexible and that use adult learning approaches. There are 5 main approaches to prevention that are used across settings. These include policy, facility and guideline reform, direct participation, organisation development, communications and social marketing, and community mobilisation. Each one of these takes a different approach. Good practice suggests that these approaches should not be used in silos, rather in combination to complement each other as part of a comprehensive approach. Turning now to the research. The research aimed to identify which programs have been introduced in sport to address violence against women and girls, whether any of these had been sustained over time, how the success was measured and understood, and whether programs had been evaluated. The methodology involved mapping prevention programs in sport and identifying those programs that have been subjected to robust enough evaluation to be included in a meta-evaluation. We then carried out a meta-evaluation of those programs and identified key stakeholders who had been involved to carry out further site visits and interviews. This helped us to identify potential participants for the round table that was based on the program mapping, site visits and interviews. 49 prevention programs in sport were identified in the program mapping. The programs were categorised as being conducted by organisations that were national, state, regional, local government and community organisations. From this 49, 14 that had been evaluated were selected for closer scrutiny. The result of the meta-evaluation showed that only 7 of the 14 had used a long-term approach, and most evaluations had focused on process, not outcomes or impact. You can see in this table the range of approaches that have been used in earlier prevention programs. The majority of these fall into the categories of community mobilisation and direct participation. Few of the programs were comprehensive. Turning now to the round table. Round table participants were drawn from programs identified in the research as having promising practice, as well as a range of other stakeholders with expertise in sport and recreation. Participants worked together to identify good practice principles and factors for success for gender equality and prevention initiatives in the Victorian sports sector. The objectives for the two-day round table were to provide participants with feedback on the research and then to confer about the findings and what works in sport from their perspective. So principle 1 is about getting started. I've already addressed the authorising environment earlier in this presentation. We were fortunate to be working in an environment where governments unanimously support prevention. Various sports also have equality and respect in their charters, so clubs wanting to implement change programs are encouraged to draw on the various rules and programs to assert the support that is in the wider community for prevention. Good governance is also important, and for prevention, the meaningful engagement of women and men at all levels of management and in all on and off field roles is essential. The third part of this principle is working with partners. Sports clubs tend not to connect with many services, such as community health, local government and others doing primary prevention. By reaching out to others in their local community, clubs can have access to all kinds of expertise and resources. After the first principle, subsequent principles are framed by a values statement. So for principle 2, the values are to ensure sport is safe, welcoming and inclusive. We plan our approach carefully and incorporate evaluation into the plan. In the past, many clubs have paid an expert to run education sessions, often with players, using a passive lecture style. They have also held one-off events without any follow-up or change in the status quo within the club. A planned approach ensures that change is comprehensive and values-driven. By establishing a business case for primary prevention, clubs are able to develop a clear argument for why proposed changes are important and to identify clear goals with the aim of engaging as many people as possible in positive change. Finally, clubs are encouraged to build evaluation into their plans, and guidelines and resources for evaluation are included in the resource. Principle 3, implementation. The value statement here is to ensure our sport is safe, inclusive and welcoming. We build capacity among leaders and members to support them as we introduce the plans. At the round table, the main issue in relation to skills development were questions about when, where, who and how. A key for experts was that anyone being engaged to run training should understand the context and be able to talk the talk relevant to each sport. Rather than using lectures or PowerPoint shows, education and training should use adult learning principles and be participatory, flexible and appropriate to context. It's important to recognise and build on the strengths within clubs. Sports clubs often have a wide range of skills, knowledge, connections and potential among members and volunteers. These people can be assets to draw on in the change process. Principle 4, putting plans into action. And this is the final principle. The value statement for Principle 4 is to ensure our sport is safe, equal and inclusive and welcoming. We put plans into action at every level. Working toward making clubs equal, safe and welcoming is very much aligned with the values inherent in most sports. The key message from the roundtable experts was keep it simple. Some suggestions for action included taking a public stand on the importance of equal, safe, welcoming and inclusive environments, and developing and living by the sports policies and codes of conduct. Communication is about letting everyone know about the plans for change. Let members and spectators know what is going on, what is going to happen and why, and communicate about the authorising environment in which the changes are being implemented. Communicate about codes of conduct and policies and about what will happen if there are breaches. Use plain language and clear messaging. So in conclusion, the design principles and guidelines are currently being tested by the Victorian Government Department of Sport and Recreation in 14 different sporting organisations. Each sports program and the principles and guidelines are being externally evaluated. The program will end in mid-2019. So thank you very much for your time today. I'd like to acknowledge the roundtable and research participants and also Professor Matt Nicholson, who has also been involved in our team. So thank you.